Most importantly, really affect the percentage. But there's something about the population that epidemiologically, yes. But then you can understand, for example, in the United States, some of the black is a factor, but not because of the presence of melanin in the skin, but because
social
of
factors.
the legacies of
Exactly.
so
What?
slavery might have
Legacy
been
Oh,
of slavery.
slavery.
So the niggas and the niggas are
the effects are still there. There are families who can't pull themselves out of poverty still because their forefathers or foreparents were given the opportunity to start educating their families and pass down the values for that attribute that values puts a value on education, right? So those social structures or structural constraints still exist, right? So not necessarily because of melanin, but a social factor. Right, so you're all correct. So, but one of the most important, or one of the important factors put forward is actually a difference in the demographics. So in sub-Saharan Africa or Africa in general, the life expectancy is lower. Most of the population, or much of the population, is going to actually be in this age group, sexually active age group, compared to Britain or Japan, where there's lots of old people. So the distribution, population structure is different, right? So that's also a factor, and then all the other things that you said, right? And mobile populations. War in Africa is an important driver of HIV. Displaced populations, setting up refugee camps. There's lots of rapes that are occurring in some of these camps sometimes. As a result of a conflict, the soldiers actually use rape as a means of, as a war tool, right? And it's very prevalent in Uganda, right? Where there's still war. So all of these social things have an effect on HIV prevalence. Can you see this little speck? No.
There's a line.
What is the speak above the line?
No, I can't see this. I'm imagining that as
Alright.
so
Take
small
this
and
one
I
very
really
low.
think that
This is fluid. The size of that dot is actually a set of branches that's indicating the variability or the different types of viruses within that one sample. I think there are about 90 patients here, 96 patients, and this is the variability that exists in flu in this 96 patients. Flu changes very rapidly. You hear about H1N1, H5N blah blah, H7N9, everything changes. Every year there has to be a new vaccine for flu. So the vaccine that worked last year may not be effective this year, because every year there's a new strain that replaces the previous strain. And there are three strains that are put into each vaccine based on the region that you're living in. Yes.
I've always heard them talking about flu and this.
Talk about what?
As in this from flu. Is it that they have a different strain of flu that works than Jamaica or something? Just then
Yes, but you know, sometimes, remember I was pointing out with HIV, the complications can come as a result of the virus itself, unique properties to the virus, or the host-immune response to the virus. So a lot of people who died from, what was the one before this? Is it H1N1? Were young people, young women, right, were the ones who were susceptible because they had a strong immune response to the virus. So it's the immune response that killed them. They got acute respiratory syndrome, distress syndrome, ARDS, and died. Not because of the virus itself, but because of the inflammatory response to the virus. So that's what characterized that epidemic. Sometimes the virus, however, is more pathogenic. Take, for example, SARS that started in southern China in Wuhan Guangdong province on the border of Hong Kong. Now, that killed people very rapidly. If you're interested in reading the story, there's a book by a